One thing that has been fascinating about working with autism is that because it's such a broad spectrum, the most common pattern is that the individuals are quite sensitive. And so it allowed us to dive into a lot more of the subtlety. Um, it can be as subtle as just having the wrong ratio of terpenes in a formula can be the difference between very successful outcomes and very poor outcomes.
You're listening to the LabAroma podcast with me, your host, Colleen Quinn. At LabAroma, we believe the secret to truly effective and therapeutic plant medicine is by understanding our plant science and backing it up with research and evidence. And this week, I sit down with a man who is incredibly passionate about what he does. Jerrik Keller is the founder and CEO of the Lighthearted Farmer. Now, he grew up in Kansas and participated in good old conventional agriculture on his family farm. He then went on to study agricultural business at Colorado State University before moving to Arizona, where he discovered cannabis and CBD and that whole world. He worked on a huge greenhouse growing medical cannabis space there, and then in 2017 he started the Lighthearted Farmer in Oregon, where he fully immersed himself in this particular plant. Through the Lighthearted Farmer, Jerrik cultivated relationships with nurses, doctors and other experts in the cannabis world. And these collaborations eventually shed light onto the need for more targeted cannabinoid formulations, which then led him to create Unity Formulas. The Unity Formulas specialises in specific strains of cannabinoids and ratios, as well as with terpenes and other parts of the cannabis plant, to form products that provide a more targeted approach for needs. And he also talks a lot about his work with autism, which is so interesting in this conversation. The company also donates 50% of all of its sales to the non-profit Autism Safe Haven. His story is inspiring and beautiful, and he tells it so well. I hope you enjoy this week's episode. Jerrik, thank you so much for doing the LabAroma podcast with me. I'm so excited to hear about your story, and I want to start at the very start. You grew up on a farm in Kansas.
Yes, correct.
What were you farming back then?
So it was a conventional farm. So we grew wheat, corn, soybeans, sunflowers.
Just good old traditional American crops.
Yep.
Okay, very good. Did you always enjoy the farm, or was it just something that was in your blood as you grew up?
Yeah, I think I fell in love with it to some extent by the time I was a teenager. I kind of had a begrudging relationship to it when I was younger, because I started working when I was about 9. And it's big equipment. It feels like a high stakes game. But yeah, I really started to enjoy it when I was about 13, 14.
At any point during those childhood years and those adolescent years on the farm, did you ever foresee that you would be converting or transitioning into farming cannabis?
Yeah, no, it would have never crossed my mind. It was a bad, wrong, or evil thing in the culture that I grew up in. So yeah, it's been amazing though to come from that background and even that initial resistance, because forced me to dive into it, take a deep look. And so, yeah, I'm definitely appreciative of the experience.
So were you of that, that North American generation where the war on drugs was a solid message that just was non-questionable? You didn't question it. It was non-negotiable, and it was a federally illegal drug. Therefore, it was really bad. Was that your sole knowledge on it as a plant, or was it even considered a plant in your mind at that point?
Yeah, when I was growing up, I didn't know if cannabis and marijuana were even the same thing. I took the pledge when I was in 5th grade. I would have been 11. It was say no to drugs for the rest of your life. Promise, sign on this dotted line here. So yeah, we were taught that it was a gateway drug of sorts, and it was evil. So Yeah, didn't go anywhere near it in my childhood.
So what happened then? Like, how did it even become a conversation around the table? Never mind before you planted a seed. How did that even start?
Yeah, so when I moved to Arizona, I had some friends that told me a little bit about cannabis. Actually, the very first cannabis I ever tried happened to be CBD dominant.
Okay.
So I actually tried CBD flower before THC flower. So
Which is probably a positive thing.
yeah, even at that time, I didn't have any vision of, working with CBD or, legally defined as hemp cannabis. But um, yeah, it was a great introduction. I think it was a smooth way of getting into it. And then there was also from the beginning this approach of being very curious, being open minded towards it, wanting to discover. Like, just because it works for somebody else doesn't mean it's going to work for me. The way someone else experiences it isn't necessarily how I'm going to experience it. So, and then the group of people I was involved with, we would have conversations about our experiences, how it made us feel. So it was very, very much an investigation from the beginning. So,
Yeah.
yeah.
Amazing. And did you decide to convert the farm, or did you add it in as an additional crop when you decided to start working with it?
Yeah, so I started my farm in Oregon, so it'd be separate from the family farm in Kansas. And I moved to Oregon with the intent of working with cannabis. My initial goal was to raise high THC cannabis. Ended up meeting some wonderful people in Oregon, learned more about hemp and CBD and other cannabinoids, and decided to go in that direction instead.
And you were one of the earliest farmers that started working with CBG dominant cultivars. Tell me how that came about and what's it been like working with CBG dominant cultivars?
Yeah, so I was fortunate enough to be introduced to the owners of Oregon CBD Seeds, and they develop all kinds of new genetics. They work with Oregon State University, trying to understand more about hemp. And so they had grown or developed CBG dominant cultivars, and they hadn't even released it to the public yet. And I was able to get my hands on some of the material from their test plot. And so actually started extracting it and working with it in that form before I ever grew the plant either. Um, but yeah, it's wonderful. It's very similar to CBD dominant hemp, which we know is very similar to THC dominant cannabis. Um, it's pretty amazing. It can be tested. One of the advantages of it is that it can be tested for this legal definition, which is the 0.3%. Pretty much the day you harvest it, it has such low THC that it'll test below that the day you want to harvest it. So it's definitely a good thing for farmers. I think early on there wasn't as much of a market for it, but now that we have more of an
Huge market.
understanding, yeah,
Mhm.
much better now,
Yeah.
especially good for the farmers.
Yeah. So I want to talk about two things, if you don't mind. I want to talk about actually farming it and also who's buying it. So let's start there actually. What are people buying their CBG for? What are they using that particular dominant cultivar and plant for?
Yeah, so what we use it for, we notice that CBG has, I call it like an uplifting effect. I think it's a little bit brighter, a little bit more geared towards daytime use. I took some before this podcast, um, some CBGA and CBG in combination. It also still has this calming effect. I think it's a good idea when it comes to supporting like different types of anxiety or depression oriented, where THC would also be a good fit in some cases. But a lot of the people we work with either have some sort of resistance to THC, either from, some ideology that they have, or, they're just not familiar with it and they don't live in a state where it's legal.
Or they're just not comfortable with it.
Yeah, exactly. So that's what we use CBG for. It's definitely great for neuroinflammation. Seems to be the best for gut inflammation as well. Um, I don't know how, we work in a very niche medicinal market. And so in the general public, a lot of the people I run into have never heard of CBG. I had a woman the other day tell me she thought it was just something that was made up. Um, so it still has a ways to go. But here in Oregon, there's a pretty standard understanding of it. But I think it's treated as just another CBD. It's going to kind of help with overall well-being. But we know that it actually has much more specific uses than that. So
yeah, I think the Dr. Ethan Russo study that came out last year, at the end of the year, I think that really helped people understand CBG. And we interviewed him when that came out, and the big lean-in was to anxiety. And since then, I hear now people refer to it as it's the THC that won't get you impaired, but it'll give you all the benefits of THC without being impaired, which in my understanding is true to an extent, but not from an analgesic point of view. It's more the anxiety element of the THC and CBG that can align, but the difference is you're not impaired with CBG.
Yeah, I definitely think there's a significant amount of overlap. Obviously not causing the high. I think when it comes to the analgesic effects, what we've noticed, if you're not going to include THC in a protocol, then usually around a 1-to-1 ratio of CBD and CBG seems to outperform either one of them on their own. So that's our go-to.
That's good. That's good advice, actually. So I want to get into what you're doing therapeutically, but let me take you back to for a minute. Was it hard to get started to farm a CBG dominant cultivar, or did you're in Oregon, which is a very progressive state in this industry, which is amazing. It's a progressive state with plants, full stop, never mind anything else, which is amazing. But did you find it difficult to get started? Did people think you'd lost your mind because you weren't growing THC or CBD dominant? No?
Well, I think that Oregon CBD seeds did a good job in selling farmers on the potential benefits, and there were some financial reasons why it was an attractive option as well for some people. But yeah, definitely it was very new. So that would have been 2018, I think it would have been. Was the first year that they released the seeds, and yeah, it was only a few farmers hopped on it, and then it really exploded from there. Now we have a massive supply of CBG in the market. So yeah, it drove the price down significantly, which I think took some farmers by surprise, but I think overall it's good for the market. It's really good for research. Any of these cannabinoids, quote unquote, minor cannabinoids, for them to really be studied and then, be accessible to the average consumer at a reasonable price, having a cultivar that naturally produces a high amount of it is super impactful. So really helped advance CBG forward when, a dominant cultivar came out. Now they have CBDV dominant, and it's just only going to grow from there.
Yeah. Talk to me about the difference between the straightforward cannabinoid CBG and then the acidic version. How do they differ therapeutically? What do we know about that?
Yeah, so a lot of our feedback is anecdotal, and then obviously I have my own direct experience, but I would say some of the primary differences is that CBGA doesn't seem to be quite as stimulating, And stimulating is even maybe a strong word. I don't know if that's its actual action in the body, but it does seem to have much more of an uplifting effect, CBG. Whereas CBGA, you still get this clearing effect in the mind, but it's much more neutral. So I think it's a good neutral base when it comes to that sedative to stimulating spectrum.
Okay, good. That's really good. Actually, I haven't, no one's defined it that clearly for me before, so that's brilliant. Thank you. And now tell me this, you work closely with, or you're aligned with a nurse who is a real champion for autistic patients. How did you meet, and how are you actually working together with the plant and autistic patients? Can you tell me a little bit about that?
Yeah, so my good friend, nurse Jana Champagne is her name. We connected in the first year that I started the Lighthearted Farmer, and um, yeah, I was eager to meet people. The majority of people that I met in the industry were in it to make a quick dollar. And so running into her coming from a medicinal background, she has a daughter with autism. So, and she has her own, healing story with cannabis, both her and her daughter. And so listening to her, it was like the first person that I had ran into that had a very similar perspective of cannabis to myself. And so we became fast friends, and she's very plugged into that medical world. Was able to introduce me to a variety of other nurses and doctors. And so one of the things that we started doing is, when a patient would have a one-on-one consultation, and there was more information gathered, then there was an opportunity for a more specific formulation to be made. And so I started doing that for patients, and that's how we learned a lot, is through that feedback system. And so eventually, a couple of years later, we started Unity Formulas, which is another brand of ours. And the purpose of it is to develop, much more targeted formulations, instead of just the broad effects of cannabis or hemp. Um, and so, autism was definitely a focus. We had worked with a lot of individuals because they had come to this network of nurses and doctors. So one of the first things we did when we started Unity Formulas is we pledged to give 15% of our sales to Autism Safe Haven, which is a nonprofit that Jana started. Uh, the goal is to create homes that will support those individuals. And so, yeah,
Amazing.
we are big supporters of that.
You're all in.
Yeah.
And which is amazing to see it, and I agree with you. In one way, the cannabis industry, especially in my experience, is there's like a double-edged sword to it, and that so many people are in there for a quick buck, and then there's others like you and Jana that are in there to educate, help people, work with the plant. And sometimes you have to dig a bit deeper to find those people that's hearts are in the right place. I always find there's a thin line in the cannabis world between making a living and then just trying to use the plant for everything it's worth, and that's where I get really uncomfortable. So it's beautiful to talk to you and to hear what you're doing with the plant in such a positive way, and especially with such a niche. So many people work with pain or PTSD or anxiety, and all those things are really important with cannabis and with the plant, but to work with autism specifically is incredible. Have you found there's any pattern or any kind of common thread that's useful in terms of, is there a ratio of different cannabinoids that are particularly helpful with autism patients? And I know that's a very broad question because autism is very different for everyone who has it.
Yeah, it's super broad. One thing that has been fascinating about working with autism is that because it's such a broad spectrum, The most common pattern is that the individuals are quite sensitive, and so it allowed us to dive into a lot more of the subtlety. Um, it can be as subtle as just having the wrong ratio of terpenes in a formula can be the difference between very successful outcomes and very poor outcomes. And so I think it forced us to, a direction we already wanted to go in. When we created Unity Formulas, the mission was to have better customer patient outcomes. Um, so yeah, we use a variety of cannabinoids. I think that CBD still has so many great effects. A lot of times we see autism and epilepsy go hand in hand, and so its anti-seizure effects make it a good candidate. CBDA is another great option. Um, the only isolate that we work with is CBN, and we add that into a full spectrum base, never use it on its own, but that has had a profound impact in several cases where we were seeing, little to no success. And when that was able to be included into a formula, we started to see a lot of success. Um, yeah, one individual we're working with is working with some of the neuroscientist doctors at UCLA, and she had been prescribed Epidiolex and was having seizures every day. And I think on her test, she was going into like that pre-seizure every about 5 minutes, and that was on Epidiolex across a 24-hour period. And so we transitioned her onto a full spectrum product that has a variety of cannabinoids in it. And the next time she took the test, she had 0 in the 24-hour period. So
that's incredible.
Yeah, pretty awesome.
Amazing. Is there any particular terpenes that you'd like to work with or avoid?
Oh, I think they all just have their own place.
Uniqueness.
Yeah, exactly. One that's found in great prevalence in most extracts would be beta-caryophyllene, and that seems to be an amazing one. We now know that it's pretty much a cannabinoid in its own right, because it has direct interaction with the CB2 receptors. But yeah, that plays a big role in a lot of the formulas. It's already the terpene that's generally found in the greatest abundance in extracts. But linalool is amazing. Obviously, all about lavender. Yeah. And for anti-anxiety effects, that's definitely a go-to. I love limonene.
What about myrcene?
Yeah, myrcene.
Great mind.
It also, you kind of have to be careful with how much you use of that, but definitely can help, carry those cannabinoids across the blood-brain barrier. So a lot of times when we're wanting to target the nervous system, that's definitely one that we use. Too much of it can become quite sedative. I think it's typically associated with those classical indica understandings of cannabis. So,
absolutely. Can I talk to you about extraction? Because correct me if I'm wrong, but you're a fan of ethanol extraction in cannabis. Tell me why.
Yeah, I prefer ethanol extraction. We do everything with certified organic, 190 proof cane sugar derived ethanol. The big debate between ethanol and CO2 are kind of the leading two, especially in the hemp world. There's still some like butane extraction, that sort of thing. That's more on the THC side of the equation. But yeah, one of the reasons I prefer ethanol is because it has just a great affinity for pulling out, not just the cannabinoids and terpenes, but also the flavonoids, the phenolic compounds, and a little bit more efficacy on that side, or efficiency on that side versus the CO2. With CO2, it's very specific. So you can specifically extract terpenes, or you can specifically extract cannabinoids. You can even specifically extract, try to target flavonoids. And so I think from my perspective, with the ethanol, you get that broad range every time. And I think the debate should be less about, ethanol versus CO2 and more about how you do it. And so it comes back to why you're making the products that you're making. And so our goal is to make something that we know is going to lead to better outcomes. That's our first and foremost place that we come from. So you can do CO2 that has this full spectrum of not just cannabinoids and terpenes, but also the flavonoids. We know canflavin A and B and C are found in great abundance. They're unique to cannabis. They have 30 times the anti-inflammatory action as aspirin has. And so we're not going to see a lot of that in the majority of CO2 extractions, because it requires basically like running the machine a third time. And so you might target terpenes initially, you might target cannabinoids. To really do well at getting the flavonoids out, a lot of times you'll mix in ethanol anyways. And the vast majority of CO2 extractions use ethanol in their winterization process. So yeah, the CO2 extractions that I'm familiar with, that I've had the ability to test and sample for myself, while they can be done really well, I think the majority of them are not done well. And
it takes a very skilled extractor.
Yeah, exactly. And so you have to know why you're doing what you're doing. Because if it's just factors like efficiency and speed, then you'll pass right over, a variety of beneficial compounds. Whereas you're not going to pass over those with ethanol, really, no matter how you do it. But even with ethanol, it's the vast majority of ethanol extractions are done at warmer temperatures, or at room temperature. It's just about pulling out as much stuff as possible. You're going to refine it later. Our stuff is not refined later. It's done in the process. So we do it at very cold temperatures. It's filtered in the process. So yeah, you can do either one really well or really poorly. But yeah, that's why I prefer the ethanol.
You put a good case across. I don't think anyone's ever explained why ethanol is a positive option before. So thank you for that. And I've asked a couple of people that, and I've never got a very comprehensive answer. So thank you. I'm grateful for that. Sorry, go ahead.
Well, I was just going to say that, if really with any herb, it's about identifying what are these active ingredients, or what are these compounds that are going to create the effects that we desire. And so with so many, if it was true that all the value in cannabis was just on the cannabinoid and terpene side of the equation, then I think CO2 would be it'd be a no-brainer. But because we're beginning to understand more and more about the flavonoids, I think that the big terpene conversation. Yeah, I'm thankful that cannabis helped advance that conversation forward. Obviously, coming from your experience, speaking more, from like people understanding essential oils, but then going, oh wait, essential oils are made up of these awesome compounds, terpenes. yeah, I think the flavonoids will be something that we begin to understand more and more and be valued more and more, be able to be, for most companies, if it can't be explained, if it can't be marketed, then what's the value? Which is why we see the vast majority of the market being isolates and distillates, because the only thing that the larger companies have been able to communicate to the general public is the value of 3 letters, CBD or THC, if you're on that side of the market. So
yeah, that's a very good way to put it. And I think, but it's getting out of the point where those 2 cannabinoids are such front runners from the rest of the plant compounds, that it's like, how do we bridge that gap and get all of these other amazing therapeutic compounds in the plant the same awareness and understanding as those 2 front runners? And don't get me wrong, those 2 front runners, CBD and THC, are amazing in their own right, but the gap isn't warranted from a botanical and a therapeutic point of view. The gap shouldn't exist. They all should come together as one family, which is what they are.
Yeah, and we know that obviously the entourage effect, we know that even the other difference with CO2 is, even if you can extract all of the compounds, they have to be split apart and then recombined again to do it in an efficient manner. And there's not a lot of science behind, well, how does that change the compounds? How does it change their relationship to each other? How they interact in the body? It's not well understood. That's for sure.
And I always say that re-emerging them or reconnecting them is a great plan B. But the thing better than plan B is plan A. And if we can do plan A every time, then that's amazing. If our only option, and especially in countries like, let's say, Ireland or the UK, where THC is not allowed, if we're trying to recreate that whole plant together without the THC, but bring together the flavonoids, the terpenes, and all of the legal cannabinoids, okay, it's what we got to deal with.
Yeah.
So do you know what? It's a fine plan B. But the day that we can have plan A, we will no longer use plan B.
Yeah. Or we'll just have to examine why are we still using plan B? And usually it's just examining our motivations, and it's usually not about the effects that we're having on the consumer.
No, it's typically not about the consumer or the plant. It's about the bottom line, which is a pity. This has been amazing. Can I ask you one last question before I let you get back to your day? No doubt you're a busy man. What's your hope or your envision for the future within this world?
Yeah, I hope that I hope that we can, we're all learning. That's the thing. And one thing that I'm committed to in with Unity Formulas, with the Lighthearted Farmer, is that when new information arises, when new science is done, am I holding on so tightly to what has worked, or insisting that I know better? Or am I willing to say that I'm wrong about how something works, or that there is a better way, and to follow, we just have to understand the impact that we're having on people's bodies and their health, and let that lead the way. The pessimism in me would say, I doubt that we'll let that lead the way, but it will lead the way for me and for many, many people that I know do a great job, many people that you've had on this podcast. Just continue to come from that place.
Yeah, I think there's no doubt there's a really strong community, and their core is that it is the therapeutics and it is the plant. And I think eventually, when the noise dies down and the novelty wears off, that is the community that will rise and shine forward, because we're not going anywhere. We're here to stay.
Yeah, that's when I first started. I said, I'm in this for the long run. Yeah. I'm not very old. I'm not in a hurry to make a bunch of money. And so, I've seen some of my peers in the industry, they were able to take advantage of, even a few years ago, profits have dropped significantly for most people, and most people are still much larger than we are, but they're trending downwards, and we're trending at a steady upwards. We keep the customers that we have because the product works. And so we just keep adding to that and willing to take the incremental journey rather than flash in the pan.
Yeah, I like that. And I think I think it's smart and moral and probably much more effective in the long term.
Yeah.
You have been a star. Thank you so much for sharing all the work you're doing. Thank you for doing the work you're doing. I get asked a lot about cannabis and autism, and I don't have answers. So at least now I can signpost to you, which is great. Thank you so much for everything you do, and thank you for your time on the podcast. We will link to everything you do, especially the 2 companies. And if anyone wants to reach out and talk to you specifically, then they can do that.
Yeah, and I'm always happy to speak to people. I don't know of many CEOs that spend time one-on-one. I don't charge anyone for my time on the phone either. So that's how I learn. That's how we get back.
We don't learn if we don't listen.
Yeah.
Yeah, literally, we don't learn if we don't listen. Jerrik, thank you so much for your time. Have a beautiful afternoon and a lovely weekend. And I'm excited to share this conversation with our beautiful audience in LabAroma.
Yeah, thank you so much, Colleen.
My pleasure. Take care. I really hope you enjoyed this week's episode. I find the work that Jerrik's doing and the passion he puts into it is so inspiring, especially how he's identified this need to create very unique formulations for patients with autism, and in some cases unique formulations for individuals, which is beautiful work. And it is, as he says, he's in it for the long run, which is amazing. It's what we need in this plant medical world. If you enjoyed this week's episode, you can go over to iTunes, Spotify, or Google Podcast. You can rate and review the podcast there. You can also subscribe so you never miss an episode again. Until next time, take care of yourselves and see you soon.